This is a technique for applying the rubber dam under any circumstances, including where there are pontics or soldered contacts. It was first conceived in the mid-1970s and has been used ever since quite successfully. As you can see, there is a pontic to the distal of the tooth which required a restoration, and yet the rubber dam was sealed perfectly in the gingival area. Here is proof of the fact that that pontic was there. So the technique allowed the placing of a foil with complete environmental control. To illustrate the required steps, we will use this situation where there is a solid bar between two abutment teeth and apply the rubber dam underneath the bar. After punching holes for the teeth, a flap is cut in the rubber dam, and you cut it away from the direction of the surface to be restored. In other words, if the lesion is on the labial surface of one of those cuspids, we would cut the flap toward the lingual. Clamp the center of the flap with a hemostat. Tie dental floss to the flap by wrapping it around the hemostat with a double loop and sliding it down onto the rubber dam, pulling it as tight as you can, and then a second knot can be a single loop so that you get a firm, tight hold of the rubber. Cut off one end to get it out of the way. Here we have floss adequately attached to the flap. On the other side of the dam, cut out a patch, which is a bit larger, slightly larger than the flap that you have previously cut. This is super glue or permabond or methyl cyanoacrylate glue. It is a wet tissue glue which just happens to stick rubber dam together like $1,000,000. Put some glue on a cotton stick and then apply it around the periphery of the hole so that you can glue the patch down over the hole that was created by the flap. Apply the rubber dam as you would ordinarily do. Tuck the floss underneath the pontic or soldered contact and pull the flap through underneath so that it goes over the patch. Remove the floss and then grip each corner of the flap with hemostats. This is important. Again, using a cotton stick, apply a small amount of glue to the surface of the patch and then stretch the flap in the direction of the tooth to be restored so that it is wrapped around the gingival of the tooth in question. Press it against the flap and glue it down. It sticks almost instantly. As I said, always apply this just using a cotton stick because you don't want any excess glue to run into the mouth. This is a wet tissue glue, and it'll stick the tongue to the gum tissue or the roof of the mouth, and you're in big trouble, so don't make that mistake. You can cut and tie multiple flaps for any number of soldered contacts. One large patch serves just fine for multiple flaps. For a posterior quadrant fixed partial denture, you would cut it as depicted here. Here is an instance where the lower molar has been hemisected, so the dam has been applied around the remaining root. In the past, periodontists used to open the furcation of lower molars if a pocket became involved, and this is an instance where that had been done, but those things often decayed. So here the rubber dam has been applied through the furcation in order to restore the lesion. Here there is a pontic, both mesial and distal, to the crown where the margin has a breakdown that needs to be restored. This demands an absolutely perfect rubber dam in order to restore that with gold foil. That's the end of the story. I hope you all will find this technique to be useful.